Wednesday, February 17th, 2021. We have a busy schedule today. We have two guests with very tight schedules, one who has to leave at 2:30 and one who can't get here until 3. So I'm going to change the agenda a little bit, but there's one thing we must start with, and you all know what it is. It's the FOIA script. So we will just get rolling here. To conduct this meeting wholly in accord with emergency procedures authorized by FOIA, the Fairfax Area Commission on Aging needs to establish 3 findings and determinations for the record. This procedure calls for 3 separate motions and votes, so I ask for your patience. I'm going to begin first. Because each member of the Fairfax Area Commission on Aging is participating in this meeting from a separate location, we must verify that a quorum is participating and that each member's voice is clear, audible, and at an appropriate volume for all of the other members. I'm going to conduct a roll call. I will ask each commission member participating to repeat your name and the location from which you are participating. I will begin. I'm Carolyn Sutterfield. I'm the representative from the city of Fairfax and the chair of the commission, and I am calling in or recording from my home in Fairfax City. The next person I see is Mike Burrell.
Hi, I'm Mike Burrell, Vice Chair of the Commission on Aging, calling from my home in the Braddock District.
Diane Watson.
Diane Watson. I'm calling from my home in Lorton, Virginia, the Mount Vernon District.
Tom Bash.
I'm Tom Bash. I'm calling from my home in the Springfield District.
Sharon Dreyer.
I'm Sharon Dreyer. I'm calling from my home in Springfield, and I'm the lead district commissioner.
Kathleen Hoyt.
I'm Kathy Hoyt. I'm calling from my home in the Mason District.
Martha Cooper.
Hi, I'm Martha Cooper, calling from the City of Falls Church District from my home in Falls Church.
Thank you. Kathy Muha.
I'm Kathy Muha, calling from my home in Oakton, Virginia, and I'm the Sully District Commissioner.
Joe Hasty.
I'm Joe Hasty. I'm the representative from the Providence District, and I'm at home.
Kathy Cole.
I'm Kathy Cole. I'm the Commissioner at Large. I'm calling from North Carolina.
Kay Larmer.
I'm Kay Larmer. I represent the Drainsville District, and I'm calling from my home in Florida.
Good. I think that's all the commissioners I have here at the moment. Please, following the roll call, we will now take a vote to establish that every member can hear every other member. And then, since we've done the roll call, I will allow Mike to
see if there's a second
motion. Yeah, run the vote, because I'm going to make a motion. Okay. I move that we have a quorum present via remote connection and that each member's voice can be adequately heard by each other member of the Fairfax Area Commission on Aging.
So is there a second for that motion? Martha Cooper. So all in favor, raise your hand and say aye.
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 And any nays or abstentions? No, so it's unanimous.
Thank you. Second, having established that each member's voice can be heard by every other member, we must establish 4 points: the nature of the emergency that compels the emergency procedures, the fact that we are meeting electronically, what type of electronic communication is being used, and how we have arranged for public access to the meeting. I move that the state of emergency caused by the COVID-19 pandemic makes it unsafe for the Fairfax Area Commission on Aging to physically assemble and unsafe for the public to physically attend any such meeting, and that therefore FOIA's usual procedures, which require the physical assembly of the Fairfax Area Commission on Aging and the physical presence of the public, cannot be implemented safely or practically. I further move that the Fairfax Area Commission on Aging may conduct this meeting electronically through a dedicated audio conferencing line, and that the public may access this meeting by calling toll-free 888-270-9936, access code 231525.
Is there a second for that motion?
Second.
I see Sharon Dreyer's hand up. And all in favor, raise your hand and say aye.
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 Anybody opposed? No opposed. Any abstentions? No abstentions. It passed unanimously.
Finally, it is required that all of the matters on today's agenda address the emergency itself, are necessary for continuity in Fairfax County government, and/or are statutorily required or necessary to continue operations and the discharge of the Fairfax Area Commission on Aging's lawful purposes, duties, and responsibilities.
So is there a second for that motion?
I second.
See Diane Watson's hand. And all in favor, raise your hand and say aye.
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 Think there are any negatives, any noes, nays? No. So no abstentions, passed unanimously.
Okay, that takes care of our FOIA business. We'll just say welcome to our guests who are here today. You will not be using your mics or your cameras, but we're delighted to have you here. We invite you to sign in to the chat at the bottom of your screen. We also have a captioner with us today, and closed caption is available again at the bottom of your screen in the toolbar there. And you're invited to offer a public comment after you've identified yourself by name and affiliation, or whether you're a community member. Also, we will have an opportunity, unusually later, when our speaker is here at 3 o'clock, Steve Descano, the Fairfax Commonwealth's attorney, will speak to us. We will, following questions from the commissioners, we will look at the chat and see if there are any questions from our visitors today. We don't usually take those, but we thought it was important when we have a public official like that to make it available. So again, welcome to all of you. And I would now like to introduce our speaker. Oh, I see we have one more commissioner who has joined us who wasn't part of the roll call. That's Phyllis Palombi. Phyllis, do you just want to say hi? She's from the Hunter Mill District. Okay. I'm now looking for our speaker who should turn on his camera. Colin Brody is our guest this morning. He's the Assistant Public Health Emergency Management Coordinator for Fairfax County Health Department. A very busy man these days, as you might imagine, and he has to leave us exactly at 2:30. So he will give us some information, and then we will have an opportunity for the commissioners to ask questions. Okay, welcome, Colin. Thank you.
Thanks, Carolyn. Just confirming you can hear me, right?
Yes, I can hear you.
Okay, great. So for those who I've not met before, my name is Colin Brody. I serve in the Health Department's Office of Emergency Preparedness and Response. I've been with the Health Department for 8 years. I am a paramedic by trade. Before I came here, that's what I did. And in addition to my work at the Health Department, I also serve on one of 2 national incident management teams for the U.S. Department of Health and Human Services. So a year ago, I was getting ready to deploy to Texas to one of the federal quarantine sites for individuals returning from overseas who were on cruise ships, which you'll remember those were the very early days of COVID. So a lot has happened over the last year for sure. What I'm here today to talk about is kind of give you an update on where we stand with the vaccine rollout here in Fairfax. And then there are some questions that were submitted in advance. So I'll run through those as quickly as I can, as comprehensively as I can. And then whatever time remains, I can take additional questions. So just starting at the top, in Fairfax, we receive 13,500 doses approximately every week. Those are all Pfizer at the moment. So we started with Moderna and then we were transitioned over to Pfizer. We're one of the few health districts in the state that can store Pfizer at ultra cold temperatures, which is one of the requirements. So we receive Pfizer 13,500 each week. And what we do is we have a pre-registration list. You've likely heard the news about that. And that is an online database, really. It's not just a list, it's truly a database. And so what we are able to do is, as we have appointment slots to offer for first dose clients, we pull names off of the pre-registration list based on the criteria and the eligibility criteria. And then those individuals are invited to schedule an appointment with us at one of the multiple locations that we have providing vaccine. We vaccinate 6 days a week. The only day we don't have any scheduled vaccines is Monday. That is the day we receive vaccine from the manufacturers and do inventory. So Tuesday to Sunday, we have vaccine operations going on. We also have locations around the county. So you've likely heard of the government center as a main location. There are kind of two speeds to the government center during the week. When the building is used by other agencies and other organizations, we can do about 900 people per day through that site. However, on the weekend, when we gain full access to the whole building, we can do about 3,500 people per day at that site. So we certainly have capacity, but again, we're limited in the number of vaccine doses we receive each week. In addition to the health department, we have partners in the community that are also vaccinating. So those are partners that have completed the CDC's requirements for vaccine distribution, and they are able to receive vaccine and vaccinate residents. We have partnerships with Inova, with George Mason University, and then with a large medical group called Trusted Doctors that operates multiple clinics around the county, but they have one site they use for a drive-through clinic. And so they are able to vaccinate individuals off of our wait list on our behalf. In addition to all of that, you may have heard about the Federal Retail Pharmacy Partnership, which is currently just CVS, but there will be more pharmacies added to that list as time goes on. CVS receives vaccine directly from the federal government, so they vaccinate according to the federal guidelines, which basically is any resident in the United States can receive vaccine free of charge through that program. So they do not work off of our wait list. They offer appointments on their website, and then individuals sign up through their website for either their first or their second dose at the time that they need it. So we don't have a whole lot of integration with CVS. The state worked around the clock with them before they rolled it out, but we weren't able to make the technology at the state level connect to CVS. So CVS has roughly 100 doses per day per location. We only have one location in Fairfax, so they do 100 a day. Not all of those are Fairfax residents. We don't have access to see necessarily who they're vaccinating, just that they use up all of their doses each day. As I mentioned earlier, we are converting from Moderna to Pfizer, so we're still trying to figure out the backlog of individuals who received Moderna 4 weeks ago, and we need to provide vaccine to them. Once we are completely on Pfizer, our timeline becomes much easier to manage because it's only 21 days between doses. And so we'll be able to kind of turn up the heat a little bit on the throughput. We're also hoping that in the coming weeks, Johnson & Johnson gains emergency use authorization, which would add a third manufacturer to the list of available vaccines here in the United States. Johnson & Johnson does not require the level of freezing that both Moderna and Pfizer do. So when J&J comes to market, we would anticipate it going to sites that don't have the capacity for ultra cold storage or frozen storage, which would allow it to get out into the community towards pharmacies and primary care physician offices and places like that. We also have a partnership with our federally qualified health centers and some of our safety net healthcare providers. So individuals who are clients of those locations are receiving information directly. That is part of the health equity task force that has been established at the state level. There's also an equivalent health equity task force at the federal level. And so we are working to try to get vaccine to federally funded community health centers directly so that they can take care of their established clients. That's kind of the high level 30,000 foot view. If it works for you all, what I will do is run through some of the questions that were received in advance, and then any additional questions that come in, we can run through too. So the first question was, how is Fairfax County ensuring equitable distribution of the vaccine to older adults in low income and minority communities? So I mentioned just a second ago about the federally qualified health center and the health equity task force. In addition to those efforts, we have a kind of formation meeting tomorrow night with some pastors and leaders in the faith community, in the minority faith community, to discuss ways that we can improve access to vaccine for individuals who may not have direct access or may not have signed up with us already. And so we're hopeful that it's more than a listening session, but we're hoping to gain some tactical planning out of that would help us provide vaccine to those members of our community who probably have not registered yet, but are interested in getting vaccine. They may not be able to get to us, so they may have transportation or other access issues. And so we're hoping to make sustained progress on that, in addition to the work that's already been done on the health equity front. The second question that was received is surrounding transportation. So is the county arranging rides to vaccination sites for non-driving older adults and people with disabilities? And then what volunteer opportunities are there for individuals to assist with transportation or helping people get to appointments? So we have worked, I'm very happy to say, we work with our partners at Neighborhood and Community Services, NCS, to expand the transportation options available. So our vaccine call center, the number for that is 703-324-7404. That's our main vaccine hub. The call center is able to assist residents who call them and say, I would like to make my appointment, but I don't have a ride. And so they can pull on a number of different resources to make that happen. There are a number of organizations in the community that provide transportation to older residents. And so based on the location of the caller, the call center can connect them with a volunteer transportation organization. We also have the ability to provide taxi vouchers for vulnerable populations, to include individuals on lower incomes, older adults, or those with disabilities. And our call center is open 7 days a week, so you can reach us, and the staff in the call center are able to assist with the appointment. If it ends up being a taxi, then it would be round trip from the resident's home to the site of vaccine. The taxi waits in the parking lot for you to finish the appointment, and then it brings the resident back home. And so that's funding that's provided fully by the county for those who need assistance. And the only caveat is that the county needs to arrange the transportation. So it's not the resident's responsibility. They call us, and then we work with them to schedule that appointment. We also have Metro Access has been providing rides to our appointments. So we have, although individuals schedule directly with Metro Access and we do not do it, we have seen, and we provide parking spaces for Metro Access at the pods or the points of dispensing, so that they can receive, those clients can receive vaccine. So that was a new development last week, that we went live with that capability in our call center, so they're able to assist individuals who call in. The third question that came in was about more than 180,000 people on our eligible list. Actually, the number right now is well over 220,000. How is the county notifying registrants of their place in line and when they might expect to get an appointment? So we actually have, last Friday, we went live with a vaccine dashboard. So I believe it's made the rounds, but I will share my screen just so that you can kind of see it in real time. But this is a new tool that we have in our toolbox that would allow us to provide a dashboard summary view, if you will, of all of the available appointments that we have. So it's accessed off of our main vaccine page, and that's what I'll pull up now to show you. So this is our main vaccine page. If you scroll down, there's below the pre-registration section, there is now a vaccine and registration data dashboard. You can click on this link, and then it'll bring you to a page that has a live updating dashboard of registration data. So it shows you a couple of different things all at the same time. On the left-hand side of the page, it tells you which day we are scheduling appointments for. Right now, we are on January 18th. We will be on the 18th for likely many weeks. We had 42,508 people register for vaccine on the 18th, and they were joining a line that was probably in the 65 to 70,000 number before that. So this part won't change for a little while, but there are 40,000 people to get through. So people on the 18th will receive vaccination appointments, but it just won't look like we're making any progress because of the sheer number of people that we have to get through. This section explains the number of people who registered each day with kind of a forward look. So the 18th was by far our largest date, but it begins to kind of taper off in the days that follow. At the bottom left, it shows you the number of people who remain on the wait list who have not been invited for vaccines, which is 103,000, and then the total registered, which would be 234,000 as of today. On the right-hand side of the page is focused not necessarily on the people in the queue, but more on the vaccines that we received. So this is for the week of the 8th through the 14th. It updates every Sunday right before we do our inventory. We received just under 14,000 vaccines last week, and we actually vaccinated nearly 16,000 people. So that happens because the vials that we receive are often overpacked. So they may send us a vial that is supposed to only vaccinate 6 people, but it has enough fluid to get 7 doses out of it. And when you have the sheer number of vials that we do, that adds up over time. So we're able to get more doses out of the vials than we are scheduled to. So that's why you see that discrepancy. And then on the bottom, it shows you the total number of doses received over time and then how they've been given out. 77,000 first and second doses have been given by the health department. 35,000 second and first doses have been given by other vaccinator partners in the community. So this is the dashboard as it stands right now. We are looking to add more data to it, but as you can imagine, the same people that update the dashboard are the same people that are cleaning the list and doing QA, QC on the list. So we've told them to prioritize cleanup of the list and making sure that people are able to get appointments. That's their top priority. And then the vaccine dashboard will expand over time. This is very similar to the approach we took when we rolled out the case count dashboard. That the first one was a quick glance, and then over time we added more and more to it. All right, and then the final question was around CVS and how to register for vaccines at CVS. So the short answer is that, again, CVS is participating in the federal pharmacy partnership. So that is not something that's controlled at the local level. Those appointments are first come, first serve through the CVS website. And they are able to vaccinate both first and second doses. And they are, because they receive vaccine allocated by the federal government, they vaccinate anyone who is eligible under, regardless of residency. Now I will move on to the chat. There was a question from Tom about what happens about inclement weather. So that's a pretty timely question as we grapple with weather for tomorrow. So if we need to cancel clinics, it's a couple of different things happen. First, we push out a message through the county's emergency blog, similar to other weather events, that has a status update on the clinics. Then we push out a message through the emergency alert network to anyone with a scheduled appointment. So if you have an appointment scheduled on a day where there's severe weather, we push a message by text and by email that tells you your appointment is canceled because of weather. And then there's a third part. You receive an automated email through the scheduling system with a link, and you can click the link to pick a new location and a new time. And so we make sure that before we hit the cancellation button that we have additional appointments lined up for the days that follow. And then if the county is closed, will the health department continue to vaccinate? That happened last weekend. We remained open with the help of DPWES, sanding and salting in front of the government center. Other sites within the county were closed, but we remained open. It is a decision made by our incident management team based on discussions with the National Weather Service and with the Office of Emergency Management about whether or not we're going to close pods. But our ultimate goal is to not, number one, we don't want people to get hurt or injured or hurt in the process of arriving, but also if it's going to be so bad that people would cancel anyway, we don't want to have vaccines sitting out, not going used. So if we need to proactively cancel, we will do that.
Oh, that's a lot of information. Thank you, Colin.
Yeah.
I'm looking at Diane Watson, who has a question for you. Diane.
Actually, Colin, I've got two questions. Thank you very much for coming. Number one is, I understand 1A was the healthcare providers in that group, but I recently heard that if somebody is assisting somebody with most of their activities of daily living, that even if they're not a professional, that they can go in under the 1A. That's the one thing. And the other one, I understand that if somebody is homebound, that there is something in the works or maybe is already in the works to get them on a list as well. Can you address those two things, please?
Yes. So first question regarding, well, let me do this in reverse order. So first things first, the homebound program, we are working with the Fire and Rescue Department. They have paramedics who can vaccinate under VDH emergency authorization. So we actually are doing a pilot right now with them. So individuals who call the call center over time to say, I can't leave my house, but I do need vaccine and I'm over 75. We do have a process worked out where our call center can take down their information. And then we have a coordinator who works with the health department and the fire and rescue department to link up teams, you know, a pair of paramedics who go out to the house, do the vaccination, log it, and then wait for 15 minutes to watch them for any adverse reactions. That program, being truthful, we are working to expand. So right now the capacity is pretty limited in that program, but we're hoping that over time we can increase the number of authorized vaccinators, and we can do, right now they do 1 vial per day. So they can do 10 individuals at a time before the vial runs out of time. But over time, we want to get that going multiple days per week. The question around 1A, so 1A did expand, and you're right that it expanded to individuals who are providing the equivalent of almost continuous care for ADLs and other things. And those are eligible under 1A. So those people can log on to the pre-registration site and they can indicate that they meet the 1A criteria. And then they would be invited. So the invitations go out, it's not a straight line because their governor has made a declaration that 50% of vaccine goes to those 65 and older. The other 50% goes to those who meet eligibility by occupation or by underlying medical condition. So we have to allocate vaccine appointments based on the database we have to match that. So it's not as simple as just a spreadsheet with names in one order. We're trying to match the governor's allocation.
Thank you.
Colin's almost out of time, so I have two things here. People thought that they would be able to go onto the status checker and find their exact number in line. That apparently is not the case.
No, that's not. So as I mentioned, that it's not really that straightforward because of the governor's 50-50 allocation. So if it was just order in which you registered, it would be a single line. But what we have to do is make sure that we're allocating 50% to those who are 65 and older, and then 50% to those who are eligible by occupation or by underlying condition under the age of 65. So we are not providing a number on the dashboard.
So people who registered on the 18th should be patient because there were 42,000 of you, right?
Right, and it's not like we're pulling, we're going in order of registration within the eligibility group. So when it is time to pull out 1A healthcare workers because we need to do occupation, we go by order of registration. So it is in that sense within a small bucket, it is in order of registration.
Great. I see that we're out of time here. So thank you so much, Colin, for joining us today. I think Jackie will gather any unanswered questions and send them along to you. And we appreciate your time.
Absolutely.
Busy man, I'm sure.
Okay. Thank you to everyone. And if there are questions, shoot them to Jackie, and then she and I have been corresponding, so I can send back email. I'll be working this weekend, so you'll likely get them on Saturday or Sunday.
Thank you.
Okay.
Thank you.
Colin. Thanks. All right, now we will go back and rescue our agenda here. We need quickly to review the rest of the agenda and approve the minutes. So does anyone have any additions or changes for the agenda? Hearing none, I ask for a motion to approve the agenda. Kay has raised her hand, and a second. Diane, all in favor, raise your hand to vote aye.
Aye.
Opposed? Okay, the motion carries. Approval of the minutes. Did you all read the minutes from our December meeting? That was the last time we met. Seems like ages ago. Does anybody have any additions or corrections to the December minutes?
Weren't they the November minutes that I missed? Did I see the December minutes yet in the packet?
I thought we got no, we didn't get the December minutes. I just flipped through and looked at minutes. What does it say at the top of the page?
It says December.
It is December.
Okay, I'll have to look at my packet then.
We approved the November minutes in December, I believe.
Okay.
The December minutes. Are there any additions or changes to the December minutes? Do I hear a motion to approve? You can unmute yourselves if you want. At the
So
moment.
move.
Okay, and a second? Phyllis, all in favor of approving the December minutes, raise your hand, say aye.
Aye.
Opposed? Okay, the motion carries. Okay, we're ready. This is, I don't know, has anyone looked in the public comment to see if anybody actually left a public comment and, just from outside here, something else? I'm not seeing anything. So we will just, again, welcome our visitors. Ask you please to sign in with your name in the chat and your affiliation if that's important. I believe we are welcoming Rebecca Thompson today, who's now in Supervisor Walkinshaw's office. So Rebecca, you could put on your camera and wave at us for a moment. Welcome. Glad, want to be able to recognize you if we run into you. So thank you for joining us. And Linda Bafana left a message, so I think this may be the last time we're saying goodbye to Linda. Is that true? Or are you going to keep coming, Linda?
No, I'm going to keep coming.
Okay, that's great.
I got to keep my eye on Rebecca. No, I'm kidding. I'm interested, so thank you.
Well, I knew you wouldn't just go away and be a retiree on the beach somewhere, so thank you.
Not yet.
Okay, old business. Excuse me, commissioner updates. So this is reports from anyone who has participated in some of our affiliates meetings. I'm going to call on Phyllis first because you have an update with your activities. You may have to leave us. So if you want to unmute yourself.
Yeah, I'm sorry, I'm gonna have to leave a little early. I'm trying to get out of town before the storm. So that was a last minute thing. Anyway, I have been still working on communication through media, and the last article that I wrote is for our local newspaper here on the different stages of the pandemic. I sent it to both Mike, you, and Carolyn, right? And I think, we're going through these stages that are just not ending, right? People are getting more frustrated. So I felt it was important to write about how families and certainly the elderly are coping. We had an incident here in this neighborhood because this good friend she's 86 and she couldn't, they were trying to think about a nursing home or, assisted living, certainly, but not during COVID. So she landed up on the floor and had to be taken to the hospital. And we don't know what will happen after this, but we have a pretty tight group here. So that felt good to help somebody, with that disposition. And it's in discussion again with Jackie Woodruff and I were talking about a continued podcast program where people can ask questions about isolation in the elderly. That will be the focus. And I'm looking forward to that and working with Dr. Richard Hilburn, we had done one of the podcasts, and we're going to continue to do that first. He'll do the medical, I'll do the psychological part. So I'm looking forward to that.
I'm muted. There we go. Thank you, Phyllis. I'm sure the other commissioners would enjoy seeing the article. We can send it, Jackie can send it on, but I don't know if there's another way to make it available to the public, Jackie. I'll have to consult with you about that. But I read it and enjoyed it myself. So thank you, Phyllis. I'm looking at Kathy Cole. Did you have any meeting time with the LTCC, with the Long-Term Care Coordinating Council during this last 2 months?
No, I did go to the Falls Prevention Alliance meeting, but they're continuing to do their work, so there's really nothing there that's new to report. But I do want to report about the think tank activities that are coming out of the COVID-19 community response plan. The Shark Tank people were approached to, as you know, that plan talks about technology and whether technology could be used to alleviate isolation in older adults and people with disabilities. But one of the things that it does recognize is that those with technology access can have the means to do that. Zoom online courses, the virtual senior center, there are opportunities for people who do have technology. So we were asked to come up with something that might be similar to Shark Tank, and while Shark Tank is not appropriate at this time because that was student-based, and students, we can't encourage them to gather in groups to do the research together or to do pilot testing. The senior centers aren't open, so it'd be very difficult for them to come up with an actual project. We came up with an idea about Think Tank, where we're going to issue 2 challenges to students and to the entire community. Community organizations or individuals, both students or student organizations, could respond to this challenge. There are 2 challenges. And we're asking people to respond to one. They don't have to do both. But one is to come up with a strategy or program to address isolation in older adults or people with disabilities who have little or no access to technology. Thinking about traditional forms of communication, very old school ways, perhaps TV. I mean, my goodness, does anybody watch regular TV anymore or listen to the radio? There may be ways to address isolation by using the traditional old school means of communication. So that's the first challenge. The second challenge is and that would be to develop a strategy or an actual program. The second challenge would be to develop a technical assistance toolkit that could be used as a resource for communities, for neighborhoods, for organizations that are trying to help older adults or people with disabilities alleviate their isolation. So this would be a way that could be adapted in various forms around the community, around the county. So what we're asking people to come up with is a blueprint, a development plan, and submit that. We are not live yet. We are about to go live. We have everything ready. We're waiting for the website to go up, and then Supervisor Harity will announce it and we'll be live. So feel free to gather in groups and come and answer one of these strategies and see what happens.
What's the timeline on this, Kathy?
It will be we will go live shortly, within a week or so. And then
following that?
And then following that would probably be sometime in early April, sometime in April for the projects to be due. And we're kind of aiming for recognizing those that are successful in Older Americans Month, which is May, but we'll see how it goes. We'll see what happens.
Thank you. Thank you. Diane, I believe you have a couple of reports.
Yes. The first report is on the dementia-friendly Fairfax initiative. I've had a couple of meetings with the task force and trying to identify sectors in the population to go ahead and talk about the dementia-friendly initiative. And Allegra Jaffe and myself have been co-presenters to two dementia-friendly programs, informational sessions. We mentioned last time since July, and we've continued that January, February, we have had two informational sessions. Linda had put in a notice in the Braddock newsletter in December, and Supervisor Stork put a notice in January and February. And with the notices and other publications advertising it, we have, as of yesterday, our last thing, we've had 122 dementia friends initiated, so to speak, or to be counted. So I asked the commissioners if you want to, when we get the announcements for the next meetings, we're trying to plan 2 a month. If I could send it, the announcement to you guys to distribute to your own supervisors to see if they could advertise it in a newsletter. You know, you can get back to me, or I can go ahead and put the word out. I do have the date set up. So that's the one. The other announcement is connecting with the Ltccc. We have not had a meeting formally since last year, but until January. We had a meeting in January 13th. Dr. Schwartz and Carolyn Zuckerman, who is the lead for the subcommittee of the COVID-19 Impact and Response Committee. We've been meeting 2 times a month since it was formed, and we've come up with some strategies and identification of different problem areas. The big push right now is on communication and isolation, understanding the same as a lot of areas. So we're coming up with some strategies. One of the things that we're talking about is there's 58 members in the Long-Term Care Coordinating Council, and they were asked to fill out a survey, and 30 out of the 58 responded. And so we've got an idea of how most of the organizations responded to this COVID, but we're thinking that see about possibly partnering with each other. One LTC member meeting up with another and augmenting whatever it is that they are doing individually to try to reach out to the greater population. So that's the strategy. We're going to be looking at that survey results even a little bit more. One of the things, it's almost ironic that we hadn't seen it before. We had a communications person come to talk to us a couple weeks ago, and we were identifying the groups of people that were at high risk because they were not getting information. And we're talking, and then at the end of the meeting, somebody said, well, you know, you're talking about you know, communities that don't speak English very much, those that are having some challenges cognitively. Older adults as a whole are a high risk. They're not listed in there as a high risk. So we mentioned that, and Patricia Rohr came back a couple days later to say that at the high risk task force it was mentioned. And so now, and older persons are listed on the high risk task force as something. And Patricia is going to be the liaison between that task force and the Ltccc. So.
Thank you. Anybody else? Martha, looks like you've got your hand up.
I have a question for Diane, and that is with the dementia-friendly training that's offered, it usually focuses on Fairfax County residents, but I'm wondering if whether so many people have relatives who are living in other states, and whether they would be eligible to join, and whether in the dementia-friendly training that's offered here. So
Yes, the answer to that would be yes, because the Dementia Friendly Fairfax is our own initiative specifically for Fairfax County. But Allegra, through the ambassador, millennial ambassadors, and she's gone out, to beyond Fairfax County. And with the advertisements that come out, we can make it possible, or if somebody knows of somebody in another area that would like to, we could perhaps arrange to have that link sent. We're trying to make it somewhat of an RSVP or restricted, because there is a possibility of, uninvited people coming in and creating chaos, so to speak. So.
But you're willing to share the access information with
Right,
anybody.
if somebody knows somebody else, yes.
More
As a
the
matter of
better
fact,
for them.
the very first information things that we did here at my campus, there was somebody that was not known to me, and that's exactly what it was. Somebody knew somebody who had relatives that they were encountering difficulties and passed the link, and so that could work.
We're getting short on time for commissioner reports. Is there anybody else? I have something, but I will defer and mine till later. If anybody else has been in a meeting or has something else to add. No? Okay, I will go quickly because we have Tara coming on in a few minutes. One thing I would like to mention right away is to recall to all of you that we were sent a link to this report from the Advisory Social Services Board, which is the advisory board for the whole Department of Family Services. They're volunteers, appointed by the supervisors and the chair, along with the director Beckett's. They form that board, and they produce an annual report that was mailed to us along with some updates about the COVID-19 response plan for older adults. It was good to get updates on 7 of those immediate initiatives, 4 of which are already completed, and 11 of the longer term, including the think tank initiative that Kathy was just talking about. But it was also very impressive to see the full range of scope of what the Department of Family Services has been able to accomplish in 2020. You can find the report online for our guests today. If you go to the county homepage, fairfaxcounty.gov, and search ASSB Annual Report 2020, that will bring it up. It covers the 5 divisions of DFS: adult and aging, children, youth and families, domestic and sexual violence services, Healthy Minds Fairfax/Children's Services Act, and self-sufficiency. Total DFS, expenditures in fiscal year 2020 came to $181.7 million, of which $25.61 million was for adult and aging services. But the department's fiscal impact was even wider. By conducting eligibility determinations for individuals and families, DFS also facilitated distribution of more than $990 million in state and federal assistance dollars in 2020. In addition to the services offered by adult and aging, it's good to learn what other DFS divisions have been doing to meet needs during the pandemic. I particularly noted the virtual parent cafes, a new child protective services toolkit, and telehealth counseling services for victims of domestic and sexual violence. Congratulations from us to ASSB Chair David Jonas and his board members, plus Director Beckett's and the DFS communications team for a fine, very handsome report and very full. So I was glad to get that. I have just a minute. If I can go a minute into your time, Tara, I'll just do this second one. The Human Services Council is a group that I usually visit, and I've been derelict because the December meeting fell on my birthday and the January meeting fell on my husband's birthday. But I can tell you from the minutes and information I've received that in December, there were a couple of important items. One was the appointment of Chris Leonard to replace Tisha Deegan as Deputy County Executive for Health and Human Services. We know Chris and have worked with him in his previous role as Director of the Department of Neighborhood and Community Services. He brings 21 years of service with the county to this new job. and we look forward to his strong guidance of HHS during this period of challenge and beyond. The council in December also heard a report from Sam Hudson of the Office of Strategy Management for Health and Human Services, OSM, on changes proposed for the county's land development policy, as well as specific components of the comprehensive plan related to creating healthier environments where access to basic needs, transit, affordable housing, and healthy food is available. The report cited the need to replace outdated and even offensive language in the existing documents. This will be an ongoing effort in the context of the One Fairfax policy, and is something I think here at the Commission on Aging we want to keep track of and perhaps even invite a speaker in this regard. The January HSC meeting featured a presentation by the extremely busy Dr. Ben Schwartz of the Health Department. And I may say later more about what he said there when we get to a discussion of our community conversations. So that is what I have for now, and I will turn the microphone over to Tara Turner, our Director of the Area Agency on Aging, for her report.
Thank you, Carolyn. Hi, everybody. I hope you're doing well and staying warm. I do have a couple of updates to share with you. I wanted you to know that our Adult and Aging Division is undergoing a strategic realignment. And there's a couple of specifics that I wanted to share with you about that. We're really trying to realign our services just to merge with other supportive services that fit the roles appropriately. So there's a couple things that I want to share with you. One is that means we're going to be building out a specific caregiver unit to support the growing needs that we know caregivers have in our community. Another thing that I want to share with you is that our registered dietitian, Maria Lowe, who currently falls under our Livable Communities Development Program, she'll be realigning to be with our other nutrition programming. So she does our menu reviews and the congregate nutrition program, and that will be aligned with our other nutrition programs like Meals on Wheels. So I wanted to let you know about that. And I also wanted to assure you that Jackie will remain the liaison for the Commission on Aging, and she will continue to oversee legislative items and other supportive services. So I wanted to make sure that you knew that. I also wanted to share with you, moving away from the realignment, that we just learned that we will be expecting an approximate $346,000 from the state. This is going to come from the Consolidated Appropriations Act of 2021, and this funding will be allocated specifically to use for nutrition. So I wanted to let you know about that, and once we receive that money, we'll be working closely with finance and nutrition programming to allocate that funding appropriately. And then for the very last part of my report, I'm actually going to defer to Jackie because she's just going to give you a quick snippet on the updates for the COVID-19 response plan for older adults.
Hi, everyone. Before I rush through this, I wanted to comment on Martha's beautiful dog. I think that might have been Maya. I'm not sure. But I wanted to give you a quick update on the initiatives from the COVID-19 response plan, as Tara said. You remember that the plan was adopted in November, focused on social isolation, technology, and wellness. And you all might be aware that the plan is now posted on our older adult webpage, along with that self-guided questionnaire for reflection of individual wellness. All of you, and maybe particularly Phyllis, might want to take a look at that. It's just some questions for people to ponder about how they are doing individually during COVID. Colin showed you the COVID-19 page on the health department website. And if you go to that page, you will see some related communications updates that were resulted as a result of this plan. That included the holiday guidance around COVID. The health department has started a blog for older adults regarding vaccine information. And soon they will also post a high, medium, and low risk activity list for older adults. And you also may have noticed that the health department provided some special content for the Golden Gazette. Tara filmed a public service announcement related to social isolation. So that will air soon on Channel 16. Kathy talked about retro TV, right? Tara's going to be on TV talking about that. And then also on channel 16, Maria Lowe, our registered dietitian, filmed 3 segments. We had shared about this with you all before, holiday cooking segments. So that is posted on the website and you can see that. There have been a few educational offerings. The Alzheimer's Association offered Healthy Living for Brain and Body in December, and they intend to offer more classes in 2021. And the Community Services Board will offer a mental health first aid for older adults sometime early this year. And then Service Source is working with neighborhood and community services to collect donations to purchase tablets for older adults. And then after those tablets are purchased, there will be a distribution and training plan implemented. Kathy updated you on Think Tank, soon to go live. We're hoping for a robust response. And those are the immediate initiatives. I know we have not very much time at all, but I will let you know that there are some longer term ongoing initiatives. Diane referenced the community ambassadors, and Linda Hernandez-Giblin is on this call today. Linda continues to share information about COVID with the ambassadors. And Volunteer Solutions continues to partner with places of worship to serve as pickup locations for Meals on Wheels. And Volunteer Solutions is also providing caring cards and virtual social visiting, as well as continuing to provide the IT on-call service for people who would like to learn about technology. I know Kay will update us on Grand Involve after their board meeting in February. And I think that's about it. Tara mentioned that we are continuing to expand our caregiver support. So we will keep you updated as the initiatives progress. Thank you.
Jackie.
Okay. So we finished a couple of minutes early, but we're waiting for our next speaker. So Mike, would you like to do a little bit of introduction here or background on conversation? Okay.
Yeah, I didn't know how precise we would be in timing it so far. Very impressive. So yeah, I can spend a little bit of time because I've been thinking about this issue of scams, but because I don't know about you all, but almost every time I answer my phone these days, I've been given some great news by the caller. They've offered me very low interest rates on my credit card. They've congratulated me on winning the lottery. They reminded me that I forgot I owed money to the IRS. I even get free technical support for my computer problems. And they've alerted me that my bank account may be compromised, plus great deals on my extended car warranty. So, but unfortunately, there's even more scams like those, especially during COVID, the adopt a pet scam. Very sad thing. People want a pet. You've read it's important thing for everybody of all ages while we're isolated. The COVID vaccine scams. We've now been warned, don't take a selfie with your vaccine card and post that online. So I won't be showing mine. And then, believe it or not, the among the costliest scams reported to the Federal Trade Commission are romance scams. So belated Happy Valentine's Day. But according to the Federal Trade Commission, here's some Commonwealth Train Toscano's come on. I'm just finishing a little bit of the background on scams here. So romance scams, according to the Federal Trade Commission, people over 70 reported the highest individual median losses through romance scams. So, if you have any single friends who get a connection to somebody on an oil rig, do not have them respond, and send the money. And for those of you who think, wait a minute, this is not an older adult issue, I said over 70 is the highest. I mean, younger people are losing money right and left on that too. But if you haven't seen the movie about the Villages senior community in Florida, that will dispel your notions about seniors and romance scams. I don't recommend the movie. It wasn't that great, but if you are so inclined to see what goes on in the Villages, other than pickleball, it's very big down there. I recommend that. But of course, not all scams start through the phone or internet. A number start with a knock on the door. These are the woodchucks that Tom Bash has been working to help fight against here. And of course, it's an issue that not only the county, but state and federal authorities have recognized as a significant problem against seniors' financial scams. And the county, of course, has created the Silver Shield program to help address the problem. Much of the focus has been on educating older adults on the types of scams to look for. But as I just went through, I mean, there's too many of them for our memories as we're getting older to keep track of them all. And our diminished cognitive abilities are more easily exploited by these clever criminals. And of course, older adults are less familiar with technology, such as how to block the spam calls and robocalls they get on their phone. And then, during the pandemic, social isolation makes older adults more vulnerable. So with that kind of as background to the scam issue, let me introduce our speaker, Steve Descano. A few things I pulled off his office's website is he was elected as Commonwealth's attorney for Fairfax City and Fairfax County and took office in 2020. Prior to this position, he served as a federal prosecutor under the Obama administration for 6 years, specializing in complex financial crimes of both national and international scope. After his work in the Justice Department, Steve was a board member for NARAL Pro-Choice Virginia, as well as representing the Fairfax County NAACP on the county's police civilian review panel. He was also the chief operations officer and general counsel at Paragon Autism Services. And as the Commonwealth's attorney, he's focused on policies that make our community safer while addressing racial and socioeconomic inequities in our criminal justice system, stemming the tide of mass incarceration, and focusing on a holistic approach to prosecution over reflexively punitive ones. So Steve, that was what I wanted to say to introduce you. And without further ado, thank you for taking time to talk to us, and unmute, and the floor is yours, or the screen is yours, or whatever we're supposed to say these days.
The screen is mine. I very much appreciate that. And thank you, Mike. It's good to see you. And thank you for setting this up for me to come here. I will tell you that it is rare that an introduction is really all about scams before someone running down all the possible scams, all the ways that somebody is trying to take advantage of individuals in our community. But it is apropos. It is essentially the business that I'm in to some degree, and also one of the things that I do plan to speak with you all about. But if I'm reading this, if I'm hearing the conversations correctly, Mike, what we're going to do today is I'm just going to kind of tell everybody a little bit about the office, talk to everybody a little bit about some of those scams that you mentioned before, and then just take a bunch of questions and have a conversation. So I see your head shaking. Yes, Mike. That's as much as on the spot as I can put somebody in on Zoom. But for everyone who may or may not know, the Commonwealth Attorney's Office is what most other jurisdictions would call your district attorney's office or your state's attorney's office. Essentially, I'm the lead prosecutor for Fairfax County and the city of Fairfax. I like to think of it as being the people's lawyer. I represent the people in the criminal justice system. And really, what we're trying to do is, build a justice system that keeps us safe, while also brings the values of the community into the courthouse. There are a number of things that we can do to, as we build a more fair justice system, actually keeps us safer as a community, right? There's the idea that we have to choose between justice and fairness, and on the one hand, and safety on the other hand, is false. We can have both because if you reform your system with a focus on justice and equality, things actually become more and more safe. So there are a couple of examples, things that we've done and things that we're going to do that I just kind of wanted to share with you very quickly before we got into the scam discussion, just to kind of give you a sense of what we do in the office and kind of where our head is at. One of the first things that we've tackled was cash bail. Cash bail, some of you may be familiar with, but essentially it is the amount of money someone would have to spend to get out of jail as they await trial. And these are for people who are already deemed to not be dangerous. So the reason why we've stopped asking for cash bail is twofold. It's a disproportionate tax on poor people, but actually study after study after study after study has shown that having people sit in jail because they're poor actually creates more crime down the road. Because it spins someone's life out of control, and it really pushes them towards recidivism. While at the same time, everybody on this call, if you're a resident of Fairfax County, the county pays $225 every single night that someone's in jail. So with a cash bail, people on this call are paying for more crime down the road. We decided to stop that. So you are not paying, and you are getting less crime down the road. It's a win-win for everybody. Mike had mentioned mass incarceration. It's a very, very similar story there. We're taking aim at mass incarceration, which is essentially not just the amount of people that are in jail or prison at any one time, but people who are involved in the criminal justice system unnecessarily. So the idea is that by keeping people enmeshed in the system when they're no longer, if they're not a risk to the community, what's happening, again, it's the same thing. The county and the state is expending resources to enmesh someone unnecessarily and just push them down more towards recidivism. So what we're trying to do is we're trying to really tailor what we do in the criminal justice system so that people can get the rehabilitative interventions that they need, while at the same time not being kept on the enmeshed in the system, saving both resources and leading to less recidivism and more community safety down the road. And a lot of that is we've heard that's what our community really wants. And, again, being the people's attorney, one of the things that's very, very important to me is to be very enmeshed in our community. So obviously we do that by talking to groups such as yourself, but we also just started, which is I think maybe the first in the state. I know it's one of the few in the nation, a Justice Advisory Council, where right now we have a body of 19 individuals from around Fairfax County, diverse individuals with diverse backgrounds from all areas of the county, who help us communicate with the community, get our message out, but also take in information about things that are important, so that we know how to better serve the community. And as we continue to build this program out, what we're going to do is we're going to put an emphasis on data. One of the things that we want to do is we want to make sure that we're a smart criminal justice system. And I'll tell you, when I came in the office in 2020, I was greeted by boxes of papers from floor to ceiling, wall to wall. We had nothing electronic. We had no records that anyone can search or pull data from. And what we're doing is we're actually building up a data program so that we can collect data, get trends, find where we can improve our criminal justice system, and at the same time put that information out to the public so that we know, so that you all know what's going on. And I will tell you, it's from those community interactions that the real concern for the scams came to our attention. Now I will tell you that scams against what we call vulnerable populations are something that are actually near and dear to my heart. As a federal prosecutor, one of the things that I did work on was targeted scams of vulnerable individuals. A lot of those individuals, seniors. I will tell you that I have personally worked on cases and flew all around this country as a federal prosecutor investigating and prosecuting cases. I've seen cases where a lottery scam, where they will call a senior and convince them that they have won a lottery in Jamaica. They just need to pay the taxes. I have seen those bank accounts get wiped out, and then and I've actually seen cases where once the individual's bank accounts are wiped out, that they essentially get tricked into funneling drug proceeds as to continue on with the scam. I've seen individuals get scammed and end up in the hospital and have the scammers call them and continue to attack them while they're in the hospital. So I know firsthand how pervasive and how these scams can be, and how they can really make individuals, particularly seniors, even afraid to turn on their computer or answer their phone. And that's a terrible thing. So, you know, what I've been doing and what this office has been doing, we're actively trying to get the word out. Right now it's tax season. One of the most prevalent ways that a scam artist will get a hook into someone is during tax season. They will pretend to be someone who works for the IRS or the Department of Treasury and gather information for individuals, or from individuals in that way. And you know, one of the scams is even they get the information and then they file false tax returns using the information that they got. So we're trying to raise awareness. We actually just put a whole bunch of stuff out on social media earlier today. We've been working with some other local elected officials, particularly in the town of Herndon, to try to get the word out about this. The other thing that we're really trying to do, and this is actually something that you know, you all could really help us with, I think, it goes into bringing the values of the community into the courthouse. Obviously, everybody in this call really cares about protecting seniors. I care about protecting seniors. It's something that I did when I was a federal prosecutor for a number of years. But these types of scams against the senior population, unfortunately, has never been a focus in this office. My predecessors never really made that a focus. And I think that is unfortunate. What we've tried to do, and what we're trying to do, is we've gone to the county with different areas of need and different things that we should be doing. And one of the things that we really need to better focus on these scam rings are more resources, people that we can dedicate, and we can really do this type of work, because it's difficult work to prosecute these types of scams, and they're time intensive. We've been working with the county for almost a year now on getting additional resources to handle different types of cases, including these cases. And I'm really sorry, I really anticipate that we'll be getting some more resources given to us in this upcoming budget, as well as a few other budget years. If that's the case, one of the things that, you know, I would ask everyone to do is, if you think it's important that these scams get prosecuted, as you talk to your Board of Supervisors member, just let them know how important it is that these things become a priority in this office, and that, you know, we're funded with that we have the resources to do it. So that is essentially where we are in terms of what this office does, and how what this office does, and how we can be more of more help on issues that are really important to you all. But part of figuring out what issues are really important to you all is actually getting a chance to hear from you and listen to the questions that you have and the comments that you have. So really, Mike, if it's all right, what I'd like to do is just kind of take some questions from people on the Zoom, so I can really get a sense of what are the things that you all really care about.
Sure. Carolyn, do you want to?
Mike, I'll let you take the questions. I see that Thomas posted something in the chat, but the commissioners really are entitled to ask their questions in person if they'd like to. So, you know, commissioners, raise your hand. Mike will call on you. In the meantime, our guests are welcome to type a question into the chat box, and we will look at those after the commissioners have had a chance and ask Mr. Descano. Okay, Mike, take it away.
Okay, so I don't see Tom's chat.
Okay, well then I'll read it.
You want to just
Sure, I'll read it.
say it out loud? Okay.
Tom, does the Commonwealth Attorney have any legal jurisdiction over phone, text, or computer scams? Or is this considered to be a matter best addressed at the federal level?
That's a great question, Tom. You know, we, depending on the methodology of a certain scam, there could be concurrent jurisdiction. I will say that things like computer scams or maybe phone scams would likely be concurrent, because what you would be doing is you'd be relying on federal wire and mail fraud charges for these types of things. But there would be an arena for your local law enforcement, your local prosecutor to potentially be involved in the cases, particularly if, you know, they aren't necessarily interstate. And also, quite frankly, as someone who did this on a federal level for over 6 years, it's very, very unfortunate, but the federal government tends to not get involved in these types of cases on a criminal basis until the value becomes very, very high. And I think, and that's particularly true of the Eastern District of Virginia. The reason being, the Eastern District of Virginia has the types of cases that they handle. They tend to have a very, very high threshold for fraud cases, just as for an allocation of resources issue. So there would be, in many cases, concurrent jurisdiction. And what I would like to see happen is that we have the ability to do those cases, particularly ones that don't rise to that level that the federal authorities would want to put their resources into, but could still, you know, ruin an individual's life. And just because that they're not rich, where they would have $1 million stolen from them, doesn't mean that they don't deserve justice for being made to be a victim of a scam.
See, Kathy has her hands up. Kathy Cole.
Yeah, apparently I have a number of warrants out for my arrest. And I was wondering if anyone, is there any point in reporting those phone calls? It's against my Social Security. Apparently, I have been engaged in incredibly inappropriate behavior with my Social Security account. And what do you do? I mean, does anybody care, or do you just let those things go?
Well, I would say, Kathy, I wanted to mention it when I saw you. We've been looking for you for years. I can't believe I finally tracked you down. You are number one with a bullet on the people that we're looking for. But Kathy, I would very much just report those calls to the police department. And here's the reason why. You know, we're the prosecutors, but the police department are our investigators. They're the ones who investigate, and what they tend to look for, or at least the investigators that I've worked with on these cases, what they're looking for is patterns. They're looking to get, you know, it's not every individual call maybe that would come in. It's when they hear 10 or 15 calls that go along with the same pattern. So I would recommend that you do reach out to the police department about it. I cannot promise that what the outcome of that will be, but I will tell you that generally, and this is what the message we're trying to get out, is to reach out, because
they can't really stop that at all.
Because the gathering all the information is useful. And Tom, I heard you come in and say that they can't necessarily stop it, but that's why they're looking for patterns, because they can't stop every single one of these calls. But when they do find patterns, what they're able to do is they're able to trace, and that's when they're able to really start to find where the bad actors are. And I will tell you that even though many of these scams, a lot of them do originate from overseas, what happens is that they do need stateside couriers and stateside individuals to perpetuate these scams, and those are the individuals that your police departments would be focusing on. The idea is, if you cut out that middleman, then the entire operation would fall.
Okay.
Any other questions? Because I'm going to jump in then with one. You mentioned two words that are important to me: data, and we just heard about trends, patterns. So what kind of data do you think you would have that could help us find out where to focus prevention problems? You know, in other words, who are the most likely people to be, what are the characteristics of the people most likely to, I see I've frozen, but anyway, I'm confused. People most likely to be impacted. You know, what insights do you think you might get once you get your data all computerized?
Well, Mike, are you asking from, when you talk about people most likely to be impacted, are you talking about from a victim perspective, or what are you particularly asking for?
Actually, it could be both. You know, in terms of the victims, for example, I just stumbled across a website that has developed, where the professor has developed a way to assess older adults' what he calls financial vulnerability. And it's like a questionnaire and interview. And then, you know, maybe those are the people you need to protect better or have a caregiver make sure they're not going to be scammed. But in terms of the perpetrators, maybe there's something about where they, how are they getting, where to focus, who to go after, and what types of scams to go after that you can, or the county can, as opposed to federal or state.
Well, Mike, I think it's really interesting, and I'll be very honest. I'm not sure how the data would be able to focus in on who a victim necessarily would be of this type of crime. I think if you were looking at characteristics of or data on these certain things, obviously you would have heat maps in different geographic locations, of course. But a lot of what we would be doing is a lot of that data would be aimed at the impacts of the justice system as a whole. You know, recidivism rates, individuals who are getting unequal treatment or treatment that's disparate or that has a disparate impact on these individuals. Essentially, it would be an accountability tool for the community to hold us accountable as we kind of build that criminal justice system that is focused in on where we need to focus. It really is all just about trying to find those individuals and trying to find areas in which we can maximize the resources that we have.
Okay. And Carolyn, you have your hand up?
Yeah, there are a couple of questions in the chat. So Martha, I'll go ahead and read yours as I understand it. I mean, when you and Mike spoke originally about the scams, that was one thing to be thinking about. But Martha says, can you contrast the danger of the scams versus elder abuse and in-family financial abuse? And maybe that's more of a problem even, or certainly a difficult one.
Sure, absolutely. I would love to contrast that. I mean, because I have, you know, my interest is to keeping all members of our community safe, and you know that really is a values proposition in terms of what we're trying to do here in the office and what's important to me, and it is keeping all of the individuals in our community safe. You know, obviously the difference between a scam that we are discussing and in family financial abuse. We don't need to, we know who the potential perpetrator is, right? It actually makes it a lot easier to get at the root of what the issue is. And also, quite frankly, makes it less likely that there will be concurrent jurisdiction with the federal government, whereas there should be more housed almost completely in your local Commonwealth's attorney's office. So we have the interest to handle all of those cases. Again, these are cases that had not traditionally been made a focus of this office, but to me, these are really, really important. And I think one of the reasons why these types of things are really, really important is, you know, it's easy to understand, for a lot of people to understand a victim of violence. Or to look at pictures and see somebody, but some people, for whatever reason, they just don't give that same level of empathy towards individuals who have been a financial victim. And my background has led me to interact with a lot of individuals who've been financial victims. And I will tell you that is true victimization as well. particularly if you're talking about in-family financial abuse, in-family elder abuse financial. That is a trust issue, breaking of trust. It can ruin families. And, having your life savings or a big portion of it stolen is something that I think we as a community, we as a society, and we as a prosecutor's office should take just as seriously as someone being attacked with physical violence. So these are things that I really, really want to make more of a centerpiece of what we're doing here in the office. And we're hoping as we get the resources to do that, we'll be able to build that type of program.
Do you have a way for people anonymously to report something like that? They think something's going on either within their own family or perhaps with a neighbor where you're aware that, maybe a relative is driving a fancier car than he or she could afford, or, you can sense when something's going on with an incapacitated or, not competent, completely older adult.
Well, I would say that, again, the police being our investigative agents, and those reports would have to go, that would be the proper place. The county police does have a financial crimes unit that would be handling these types of things generally. And I'm sure that they would be able to take that type of call, but I would say that as this moves down the train, the need in prosecution, we would need witnesses to testify and individuals to provide evidence if we were to move forward with prosecution. But I would say that anyone who has that information or sees something, regardless of how comfortable they feel at the moment of publicly doing it, they should call and ask to be connected to the financial crimes unit in the police department to give over that information.
Thank you. Mike, there's another question in the chat. Do you want to look at that?
Okay, again, I think I don't see.
Oh, okay.
It's not in my chat.
All right. About having to do with the police department, somebody, one of our visitors says, I have called the stations to report and police do not want the information about scams. Could there be more communication to train and have Fairfax County police stations take that kind of information and have a more coordinated response?
I'm really, really sorry to hear that. I'm sorry that that's the response that you got from the police department. And I will tell you that there is a financial crimes unit that can handle these types of things, but but this is a great example of why these types of conversations are so valuable. I had not heard that people were getting this response until I talked to you all. Now, hearing this, as soon as I'm done with this, what I will do is I will have this information passed along to the police department to let them know that this is the response, that this is the level of service that some members of our community have gotten, with the idea that we can train individuals at the stations to dispatch these calls to the appropriate place so that people can get service and feel that they're heard. Because I will tell you that, working with our police department, they do take crime seriously. And again, there's a whole unit set up to handle these types of cases. Just because maybe they're a small unit that not all the stations know about, that would just be a training issue. And we'll pass that information along to the police department, hopefully for remediation.
I just thought it's really important. If we already know a lot of people who are victims of scam do not even try to report it. They're embarrassed about it. Mm-hmm. And so now we're getting even another reason for underreporting it that maybe hinders efforts that we want hinders efforts to convince legislators and prosecutors, police to do more to stop it and prosecute it. So kind of related to that, can you think offhand of any new legislation at the state or county level that might help your office in, when you get your own resources to staff things up? Are there laws that make your job easier or more effective that need to be passed? Or?
Well, right, nothing that is, Mike, I would say that's a great question, but there's nothing that is top of mind that we would need. It is, we do have, like a lot of things in criminal justice, in the criminal justice system, the tools tend to be out there. It is just a matter of having the resources to go use the tools. Now, there may be some, to drive the analogy a little bit further, there may be some sharpening or some shaping that we can do on some tools, but I will tell you that by and large, the tools are there for us to handle these types of cases.
Okay. Yeah, I didn't know. I mean, as someone who knows about legal prosecution from watching Law and Order or other TV shows, just seemed like, why not ask that question? But also, I mean, I'm wondering, you mentioned getting the middlemen and women. We can't go overseas. Are there enough I don't know, laws that allow us to go after the middlemen, whoever it might be?
Yeah, there are, and I will tell you that even if those individuals were out of state, we would still be able to extradite them when necessary into Virginia jurisdiction. So the tools are there. If it's an international thing, that would be a partnership or in the purview of the federal authorities. I know that I personally, when I was a federal prosecutor, was involved in some of those international cases. As a matter of fact, one time I had an individual from Peru who had been scamming individuals in Miami that I had been tipped off to that he was going to be in Houston for 4 days. And I actually sent FBI agents onto a plane in Houston to pull this guy out and bring him to Miami while he was in America. And that is of course, the purview of the federal government. But yeah, there are plenty of opportunities for us to hold bad people accountable as long as we have the resources to do it.
Are there any other commissioner queries for Joe?
Yeah. Hi, Steve. It's good to see you again.
Good to see you, Joe.
I just want to know, does your office have a connection or coordination with the Adult Protective Services?
I'm sorry, for some reason we blipped out.
I was asking about the connection with your office and Adult Protective Services.
We occasionally connect with them on individual cases, but I want to ask you, Joe. Obviously, you've because we get cases about abuse and exploitation, those sorts of things on a case-by-case basis. But I wonder, from your question, do you have something? Do you think that there's a gap in the system that you think that we should be addressing?
No, not necessarily. I was just curious. I've been serving on the county's pre-guardianship panel, and a lot of the cases that we deal with involve scams and exploitation, financial exploitation of older adults. And I was just wondering about your office's involvement in resolving some of those cases or getting involved with investigating them in any way.
Yeah, I would say those cases we do occasionally. They will get referred to that financial crimes unit in particular, and if the financial crimes unit, we're able to investigate and find what they thought were criminal violations, they would come to us. We would work with them to fashion charges in appropriate cases. But that is a very ad hoc, case by case situation. But we do get cases through that avenue.
I'm wondering if to conclude here, because we're almost out of time, but is there some case that you've worked on relative to older adults and some kind of financial abusive situation that gives you the idea of advice that we should offer to our constituents, our friends, and our neighbors? This is something that the Commonwealth's attorney says they see, and you should be aware of it, and here's how you could protect yourself against it.
That's a great question, Carolyn. I will tell you, I was talking to another group about this last week, and a couple of things that I told them, I'll tell you all, that I would love for you to share with everyone that you talk to, your neighbors or friends. If it feels wrong, it probably is. And it should feel wrong when someone is trying to rush you to do something. If someone is trying to rush you to take an action, if they tell you, if you don't do X in the next hour, or you don't do it by this, that is red flag number one. Because what these scammers are trying to do is they're trying to confuse you and put you in a state of terror. And that can only last for so long. So what we see is, well, look, we need your password right now, or your access is going to cut out, or you need to go to the bank right now, or you need to get to this store and get us these cards before it closes. Any language like that should be a red flag. And the other thing that I would want to pass along to everyone in the community is something that Mike touched on earlier, which is people feel ashamed when they realize that they gotten taken advantage of, and people shouldn't feel that way. I personally know doctors, college professors, engineers, very successful people that have fallen for these scams. So falling for these scams doesn't mean that there's anything you should be ashamed of. It just means that they're very good at scamming people. So what I would tell people is don't be afraid to speak out. There's nothing to be ashamed of. And if you're getting rushed or you feel something's wrong, put the brakes on it, because you're going to come out better for it.
Sounds like good advice.
Thanks, Carolyn.
Hey, I need to talk to my son, or I need to talk to my daughter about this. You know, that's another way to get rid of them too, right?
Oh, 1,000,000%. Exactly. I will tell you what, that is a great advice, because if you say I have to talk to my son or I have to talk to my daughter, inevitably what'll happen is that person will get pushed back out. There's no time for that. And that is them trying to keep somebody on the hook.
A red flag.
So I think we can bring this to an end, and thank you very much for speaking to us and answering our questions.
Thank you, Mike. Thank you everyone for having me. It was a pleasure. And I look forward to hopefully the next time I get to speak to you all will actually be in person. Thank you. Thank you everybody for your time.
Thank you very much.
Thanks again.
Thank you.
There was a posting on here about the need for a who to contact list when things happen like this on the phone, or you have a scam problem. I think that's something we could ask Silver Shield or to work on and create that. It may even be in our services book. I haven't looked at the newest version. If you've got a problem with email addresses or phone numbers. So something for us to work on from our end. Okay, thank you, Mike. That was a good connection. There's just a lot going on right now, and the phone rings all the time with this spoofing, with your local number that looks like it could be a neighbor down the street. So that's another thing to watch out for. At this point, we're on to new business. And the first item in new business is Mike again with the pickleball question. So I'll let you present. Everybody should have received a copy of Mike's cover letter and also the suggested letter that we would submit to the Fairfax County Park Authority. So I'll let him talk about it now.
Okay, yeah, and I don't, hopefully because of some of the information I sent ahead of time, the point of what I want to say is pretty clear to everybody, but obviously feel free to ask questions or bring up a different point of view. But because of the county's park authority's effort to initiate a study of what they can do to support the growing interest of residents in playing pickleball as a recreational and socialization activity. They had a survey that they were asking people to fill out, but they're also asking if you have comments on it to send it in. So the motion I wanted to make was to see if the Commission on Aging would vote to agree to send the draft letter of comments that I sent out to you to the Park Authority. And basically it talks about not only—
Mike, why don't you read it? for the benefit of our guests who haven't seen it.
Okay, yeah, it looks like there's time. So this would go to the Park Authority's study manager. And it says, in response to the request by the Park Authority for comments about the study being undertaken, which they're doing in coordination with the Department of Neighborhood and Community Services, as an aside, because a few of their community centers have indoor hours where they put up temporary pickleball courts. So the study is to assess the need for pickleball facilities. The Fairfax Area Commission on Aging is pleased to submit the following in support of the need to provide more indoor and outdoor venues. We base our support on the increasing popularity of the game with older adults. Among the reasons for its popularity is that it does not require as much running as tennis, is easy to learn, is inexpensive to play, and is lots of fun. It was originally developed by parents looking to play with their children and continues to have intergenerational appeal to older adults who can play with their children and grandchildren. It also provides important opportunities for social engagement among older adult communities because the game is typically played in doubles matches where there are multiple courts per venue, and those venues support drop-in play where players of all skill levels can participate and meet other like-minded active adults. From an equity point of view, we believe Fairfax County should devote more of its recreational resources to older adult needs for fitness, wellness, and socializing. The Park Authority and Neighborhood and Community Services, I think I see a typo in there, but we'll get that, can play a role in supporting those goals by making our county more pickleball friendly. To that end, we recommend the building of pickleball venues with permanent courts not shared with tennis, as well as an expansion of indoor court hours at affordable prices. Thank you for initiating the study and for considering our comments.
Okay.
So,
I wanted to ask if the commissioners then had any comments to make about the letter or any concerns or observations or wants to add something. This is the opportunity to think about that language. And also to think about, advocacy in general. We've supported things before. So when do we do that? What do you think? Anybody? Raise a hand. Okay. You need to unmute yourself.
Okay. I support this because pickleball down here is such a big movement and it really does encourage socialization and getting out and intergenerational activities. But I think it might be helpful if we somehow framed it using the words age-friendly community, because I think the parks really need to expand their recreation for age-friendly. We love the children having activities, but I think it's also important for us to consider making all of the recreation and parks age-friendly. So I think if you broaden it a little bit, I think it makes a little more clout for the Commission on Aging to come forward with.
Mm-hmm. So where would we put that in? We base our support on the increasing popularity of this age-friendly game?
Yes, yes. That's a great way, Carolyn.
Okay. Anybody else? Tom?
I think it's a great idea, Mike, and I fully support you. If you need any help trying to get this to the county, I'll use my limited experience to assist you in that.
I know Supervisor Harity has done some things to support it, so you can
sure, I'll do that.
Voice to his, give him more support.
Sure, I'll be glad to do that.
Okay, anybody else have a comment before we put this to a vote? Joe?
I have a question, Mike. You're planning on having us send it out as a letter of endorsement by the Commission on Aging?
Well, it's comments to the Park Authority's study director that yeah, to support.
Well, it's a recommendation.
Yeah.
It's in support. Yeah.
Okay. Also, pickleball, I'm sure is conducive to improving balance, and we do have a balance initiative.
Well, yeah, as I pointed out too, it's part of the P initiatives we might take up in SHAPE, the SHAPE program.
Personal well-being.
Right.
Mhm. So, but balance is a good point. We could
Oh,
add
I did
balance.
fall once playing pickleball, so.
Oh, you fell? Oh, well, maybe we shouldn't say that then. What do you think, Kath?
My balance has gotten a lot better after I fell.
Sharon, did you have something?
Just a question. In the last paragraph, I wonder about using the word encourage instead of believe. Maybe believe is stronger. I'm not sure. We encourage them to devote more recreation, but so I don't know whether encourage is a better word than believe, but just a thought.
Is that okay, Mike?
Yeah.
Encourage Fairfax County to devote.
I
Right.
like that.
I
Yeah.
was thinking in an earlier version of this, it occurred to me, I was thinking about the adult fitness equipment that we all had an opportunity to try out a few years ago. That's the kind of thing we're looking for, particularly outdoor things. So it didn't get in here because this is supposed to be all about pickleball, but I think it's, we may get more requests. The more of these letters we do, the more requests we get. While Mike and I were going back and forth with Jackie on this, we received a letter, the commission received a letter that was forwarded to us from a man who was upset because the park authority was about to raise the rates for seniors to camp at Lake Fairfax. And he wanted the commission to object to that. And unfortunately, by the time it reached us, the timeline was such that the decision was going to be made before we met. So we didn't respond to that request, but there may be other things like that that come before us. So it's something we should think about, what is our role vis-a-vis, but as an intermediary between the public and the county services that people want to see, especially older adults. So, Diane.
I think Kay brings up a good point. The recreational centers are there for the use of all the area people in the area. And I think there might be a preconceived idea about what kind of equipment and areas can be set aside for older people. And, it's not necessarily just swimming or sitting on the machines or doing the machines. Some activities that involved a little bit of physicality. And you mentioned also like the outdoor gym equipment. In Fairfax County, I think there's only one rec center that's got the outdoor adult center equipments. So I think it's something to be considered and enforced a little bit. Encouraged is a better word.
Is there any more discussion? Shall we put this to a vote, this particular letter? Do we feel okay about the vote?
Yeah, as amended with a couple of those word changes, sure.
Okay, so Mike, do you want to make the motion?
So yeah, I make a motion to have us send this letter, these comments to the Park Authority, adjusting some of the wording to include age-friendly, encourage, and use the word encourage the county to devote more resources to these needs.
Okay, do I hear a second?
Second.
Second from Tom. All right, all in favor say aye and raise your hand.
Aye.
Aye.
Opposed? Okay. Abstentions? No. The motion passes, Mike. We can send
Thanks.
Yeah.
I'll send you the corrected version, and the next steps would be for you to put it on some official stationery of some sort, or email, or just
Yeah,
email it.
Jackie can take care of that, right, Jackie?
Absolutely. I'm on it.
Right.
We will get Hilda to put it on pretty COA letterhead and ask that Carolyn, both you and Carolyn sign it, or maybe just Carolyn.
That's fine.
Thank you.
Happy to do that.
All right, thanks.
Okay, we have just a few minutes, Jackie, for you to talk about the COVID-19 vaccine conversations that we had last week.
Okay, just a quick update for you all with a quasi question. So you all saw that 2 forums were held last week on Thursday and Friday, specifically for people with disabilities and older adults. And Dr. Schwartz, the epidemiologist from the health department, presented. I know a few of you attended. Thank you for being there. Dr. Schwartz is amazing. Patricia Rohr said he's like our Dr. Fauci. And he said, you know, I knew Dr. Fauci when I worked at CDC, and he really is as wonderful as he seems. But the information was really comprehensive, and we actually had to close off the Zoom sign-offs because we were nearing the 300 person limit that we have for our Zoom accounts. So we had to turn some people away for those forums. And based on that, we were thinking maybe that indicates that we should offer more forums. And we wanted to talk to the Commission on Aging about if we decided to do that and the health department had availability, would you want to be co-sponsors? But let me tell you that since then, you all saw that AARP is offering a forum with Dr. Gloria, the director of our health department, this Saturday. Juliana Valencia from our caregiver support team is offering a forum in Spanish next week. And I know that members of the Board of Supervisors are starting to offer town hall COVID forums. So now we're a little less certain that there is going to be a large and loud demand for an additional forum focusing specifically on older adults and people with disabilities. So we are not necessarily pushing for that right now, but I guess we'd like to hear from you all what you think about whether there should be another one. If we do hear from people that they would like another one, you know, some of these people who tried to register and got the message that the forum was full. If that is the case and we want to schedule one, then you could let us know if the COA would want to be a co-sponsor. So any thoughts on that? On whether or not we should consider offering another forum for older adults? And again, no guarantees. We'd have to work with the health department. What do you all think?
Diane?
I think as much as we relay information to our particular neighborhoods, our communities and everything, and they appreciate updates and things like that, there's something about them being able to attend something and question with their own voices, to have that opportunity that seems to go over. So that's my thought.
Okay.
I really support it. I think that it really would be well attended. My question would be, could you increase the number from 300 to more? Because that might be eventually a good way for many things through the Zoom meetings for communication to improve. I know there's an additional charge, but I don't think it's that much. Is it, Jackie? Or do you know?
So our account that we've been assigned has a limit of 300. We did learn that there may be a way to access another account, a bigger account with up to 500. So if we were going to have another one, Kay, we would try to work our secret channels and see if we could use that one.
I knew you did, Jackie.
Oh, you know, we got secrets, right?
Kathy Muha? Oh, you're muted still, Kathy. Kathy, you're muted.
Just testy this afternoon. My question would be is would it be something that we do maybe into the future so that as the distribution continues and things change, there may be different types of questions that have been answered over the last couple of forums?
So I can answer that, Kathy. The answer is yes. They're trying really hard to keep up with all the changes. And so I know that with each new forum, the members of the health department are providing the most current information. And Colin was good about that today. So yes, good point. And again, we don't know if this will be a possibility. We want to try to read the land and see if we're hearing from people. But if so, yes, we would try to make sure it was up to date. look at the time. And we just wanted to get a feel from you all. You know, last time the forums were hosted by the Disability Services Board. This was the idea of Claudia Villa, who supports the DSB. And we would have invited the Commission on Aging to be co-hosts, but of course you had a recess in January because of the inauguration. And so, you know, you couldn't discuss it as a group because of FOIA. So the AAA was the co-sponsor, but, you know, noted. So if we are going to have one of those, it sounds like you all would be interested in being a co-host. I suppose we should take a vote on that, Carolyn. I'll turn it over to you. I was just introducing the topic. But
Interested in taking part in some possible future event.
yes, it's a vague vote,
I'm
right?
waiting for something to change. I mean, it occurs to me sitting here that if the Johnson & Johnson vaccine becomes available, that would be a good time to have a COVID event forum so people can say, well, how is that different from Pfizer and Moderna? Am I still safe if I get the Johnson & Johnson? You know, is it going to be available to more people? Maybe younger people can have that one. It's the one-shot one. So, you know, that kind of change is what I think, because right now there's a lot of information on the health department website. I don't know how useful it is. Their call center is pretty overwhelmed with people trying to schedule or figure out what happened with their appointments. So they're not going to be able to answer any questions other than just, you know, appointment related right now. We need to close out here. I'm not sure there's a vote today. What do you?
Why not?
A vote?
Yeah, why not?
So what's the motion? Make a motion then, Kathy.
I move that we support any efforts to provide information on COVID-19 situation in our county to our constituents, our friends, our neighbors. Information can only help, not hurt.
Well, I think we already support. I'm looking for a motion that says we're going to participate or
Okay,
help
I
to
move
organize.
that we participate in a forum. I think it'd be good for the Commission on Aging to have that.
To be seen?
Yeah, to be seen.
Okay. So
Second it.
the motion is that the Commission on Aging is willing to participate in organizing or being part of future forums on COVID-19. Is that what it is?
That's what it is.
Okay, do I hear a second?
Second.
All right, Sharon, all in favor, say aye.
Aye.
Aye. Opposed? Okay, that motion carries. And now it's time for announcements, and so we can be on our way. Anybody have an announcement?
By the end of the month, I
can't read that, Tom. I don't. Oh, let's play pickleball, it says on his Kermit the Frog there. Okay, I'm sorry, I interrupted your announcement.
By the end of the month, I think most residents at Green Spring who wish to have vaccines will have had an opportunity to have them.
Hey,
both 1 and 2.
Excellent. Anybody else? Upcoming events, anything we should know about? Well, if you hear of something, let us know. Remember, you can send an email one way. We just don't reply to each other in a group, because then we would be breaking FOIA. But if you have some information for all of the group, feel free to send it out. Just don't answer such a thing. Okay? All right, I will now entertain a motion to adjourn. Who would like to do that? Sharon moves to adjourn. Second, Diane, all in favor?
Aye.
Aye. Opposed? Hey, thank you all. We are adjourned. We'll see you in March.
Thank you.
Thank you, Carolyn.
Take care, everybody.
Yes. Take care.
Take care.